Even more ironic is that this pinch hitter was actually a pitcher in college. So we're bringing a college baseball pitcher into pinch hit. But let me tell you, I'd like to tell you just a little bit about SpineSearch and, in all seriousness, Nicola Hawkinson, who started SpineSearch. She's has her doctorate in nursing, was a nurse practitioner, master nurse practitioner, and started SpineSearch, what, about 10 years ago, Reggie?
Yeah, 2009, 2010.
Yeah. Had a last-minute personal issue come up today. She couldn't make it, so she has sent us. We're very happy to have Reggie Roy. Reggie is her senior recruiter for physicians and executives. Now, SpineSearch, and I'm going to steal your thunder, but they do specialize in the area of spine and neurology. But I think a lot of the information that Reggie has today is going to help you from a recruiting standpoint, regardless of what the medical specialty is. So with that, Reggie.
Thank you, Joe. And I just want to say thank you to Neuro also for putting on today's seminar, and thank you all for coming here today. Again, I'm Reggie. I've been working with SpineSearch for the past about 6 years now. I do specialize in physician recruiting, executives, mid-levels. We do, as a firm altogether, everything from front desk to physician. We also do consulting also, and as well as revenue cycle placements for practices throughout the entire nation. I started with SpineSearch about 6 years ago. Prior to that, I was doing supply chain and the chemical sales into the pharmaceutical market. And right out of college, I was interning with the Clinton Foundation under President Clinton and the Haiti relief effort. And but then I found my way to a startup and haven't blinked since. Here today, we're talking about the industry and recruiting. A lot of the subjects that we're going to be covering in my presentation is a little bit of a combination of Jeffrey, Tony, and Dr. Tobias just now. But I'm going to go through like what you need to know, help you figure out where you want to navigate your search and narrow it down so that way you're not fielding 20 different offers, where you can narrow it down to 5 solid ones that you know are going to all have competitive measures in your interests. So again, what is SpineSearch? We're a recruiting and staffing an education company. As Joe had mentioned, we're clinician-owned, where Nicola Hawkinson started off as an OR nurse and then to a spine nurse practitioner, hence the name SpineSearch. But again, we do staff everything from front desk to physician nationwide, and we've then expanded now to other specialties outside of just spine, and continue to grow the company into even now the revenue cycle elements, as well as research and so forth. We consider ourselves experts in the field. We're identifying all the different market trends. What you want to know from this is pretty much that we know the space. We're connected to Neuro, a neuro monitoring company. We're at the ground level. We're talking to everybody from the front desk administrator that's welcoming patients to your office, to the scribes that are entering your patient notes, to the billing managers that are getting you reimbursed and paid at the end of the day. We're not just recruiting doctors again, we're recruiting everything from your front desk to physician. We one time recruited a private driver for a neurosurgeon, so that way he can do his patient notes from leaving from one office to another, giving him that more opportune time. Or he could also step away and do his patient notes and consult with an insurance company. We like to consider and partner with everybody in the industry, as we can eventually staff for you. I'm not going to have the luck of actually placing you in your position, but wherever you end up, I could help you find your billing manager, find your practice manager, help you add on ancillaries, and merge with another group. We partner again also with other employees and employers. A lot of employers approach us because they have a need and they don't exactly have the time or the resources to explore what's going on in the industry. Just one case and scenario, and right here in our backyard in New Jersey, Hackensack, JFK, and Meridian all just merged. A lot of practices are, kind of rattling up. What do we do to compete? Now they're a conglomerate. So these are the things that are, you here at the ground floor, and we're here as a resource to help you adjust. So I know this was mentioned in one of the other presentations, but about half the room, pretty much more 45% of you are going to actually aspire to be in academics. At the end of the day, 16% of you will actually follow through with this. But then even so on, 38% will then leave in that 10-year span. The remaining percentage, you'll go through the associate professor to the director and hopefully even that chairperson one day. But this is just something to definitely be cognizant of and help you decide whether you want to end up being in a hospital or a private practice. More than half of spine fellows come out of fellowship will actually leave their position within the first 3 years. This is due to a number of many reasons. There's changes in the facility that goes on, changes in the business plan, as well as change in the practice, change in competition. And overall, there also could be undelivered promises as well that may come up. And otherwise, there's also personal reasons that might come up as well. Your family decides to move and up and relocate to California, or vice versa. Some more facts for you. There's about 149 medical schools in the entire country. I think it was stated in one of the other previous presentations. We're going to have a shortage, and that's probably estimated by 2025. So how are we adjusting? Does that mean you're hiring more mid-levels to be in your practice? Are you hiring more LPNs or scribes? Eventually, even though you guys are your residents and fellows right now, by that time, you're going to be leaders in your program, whether you're in academia or private practice. What are you going to do? Put yourself in that shoes. How are you going to become a leader in your community and get more physicians to your group? Or how are you going to adjust to the time and get more mid-levels or support for staff? For the neurosurgeons here, it definitely took you about 10, 12 years to get to this point where you're about to complete. It's going to take that same energy and time into your job search. It's important that you take all the meetings that you can, go to all the interviews that you can, do as much research as you possibly can on that practice or facility that you decide to join. What you got to do first, though, is identify your need. What criteria do you need to hit in the facility that you're joining? Do you want to be in research? Do you want to be doing publications? Also, that turns to what other criteria do you need? Do you need to be in the rural area? Do you need to be by a train station? Is this facility giving me a PA? Are they giving me an NP to run my outpatient office? These are things that you need to consider when going into whatever job you end up going into. So the ever so question that you have in residency that you ponder amongst yourselves is, am I going to go into academia? Am I going to go into private practice? There are hybrid formats, as Dr. Tobias had mentioned, as well as Tony. I think another ongoing trend or word that this is called is privatedemics. There's a lot of affiliations, private practice that you can do the research. You have opportunities to be published, but then in academics, that's also within academics, but within private practice, it's also an opportunity for you to just do surgery and run the practice in the business operations. So in these next couple of slides, I'm going to go over 5 key elements. Location being a huge piece. Location. Academia versus private. Really knowing yourself, knowing the practice, doing your research again, and overall just contracts and negotiation when it comes down to the offers that you might receive. So location. Do not underestimate where you're looking. You need to narrow it down to a significant area. That way you can narrow down the search of what practices are in that region, as well as, and other criteria that might go into it is, where's your family from? What are the schools in that area? And then also, what are your personal interests? Are you a skier? Are you a hiker or a biker? You also want to look at the patient population. I'll give a local example to me in Long Island. Are you going to be in Brentwood or are you going to be in Cold Spring Harbor? Two ends of the spectrum. Those are the type of patients that you're going to be looking at. With this, that's coupled also is the payer mix. The payer mix, which is, you're going to look at, well, what is this practice or this facility asking me to do? Am I going to be an out-of-network specialist? Am I going to be doing totally Medicare, Medicaid? Am I purely going to be doing, or am I going to be in-network? You're also going to want to look at the practice's growth. Tony and Dr. Tobias coming from a huge practice. They're continuing to grow. They're the largest practice in the Hudson Valley. So you already know significantly that the practice is growing. You want to do your investigation of what's going on in the region. What are the competing practices doing to stay in business against a practice like Dr. Tobias's? Is that practice being also susceptible to being bought out by a hospital? Or if you're looking into academic, is that academic program ranked nationally, and what programs are they offering? Do they have that neuroepilepsy program? Do they have that is it ranked? Do they have that robotic arm in that facility? And those are the things, then criteria that you need to look at if that's what you're going to end up specializing in. You also want to look if you're going to be the first person to join that facility as well. Again, with location, you want to find a place that you have the ability to raise a family. You want to be able to keep in touch with your roots. If it's whether it be a synagogue, temple, or church, make sure that's in that area that you're looking at. You want to make sure that the schools are up to par, with what your criteria might be, so that way you can raise your family and be comfortable for where you're looking. And also you want to look at how the population is in that region. Is it going to be, a less dense populated area, or is it a heavily saturated region? And that's going to be a huge factor into your decision. Last piece on location is, again, climate. Do you want the beach house, waterfront? Do you want to be on farm acreland? What region of the country, southeast, northeast? Narrow it down so that way you know where exactly you're looking, whether you want to be in a rural area, be the one practice in the 50, 60-mile radius, or are you up for the competition and want to be right next door to your competitor? Are you okay with being inland or on the coast? Do you want to be in a rural suburb, or do you want to be in an urban area? How close are you or far away from your friends? And are the different cultures that you're coming from in that area, so that way you feel comfortable with your surroundings? And also, again, schools for your children that you potentially want to be raising in that area. And it's okay also to be a nomad and be in that 50-mile radius with nobody around you. So to touch on Jeff's and Tony's presentation, I have no biased opinion whether you go private or academic. So hopefully you could take that to, I'll list out both the pros and cons. So within private practice, tends to be more of a lucrative opportunity. You'll tend to see something called the eat what you kill model. It's kind of like a commission structure in a nutshell. You're a lot more autonomous in the day-to-day decisions. You're able to take on more of a leadership and stand in the actual practice on its day-to-day operations, as well as the control over the overhead and costs, over the equipment that's in the facility, to the staff that you're hiring, and the expansion or the decision to hold back on expansion. The other opportunities, buy-in or equity into the practice or partnership, as time goes on. Or if you're joining a small group, is that an option that you want to do? Do you want to be one of two surgeons in the group? That's going to also entail a lot more long nights of marketing the practice and building the practice, as well as staying in touch with the state compliance issues that might be coming up as well. You also want to be able to stay in touch in terms of like the insurance companies. You have to renegotiate constantly with the insurance companies. What's going to be my reimbursement there? And all in all, it's going to be longer hours. It's going to be rigorous, marketing dinners, meeting with reps and so forth. How are you going to get the referrals? How are you going to get the surgical volume that you seek to make the figures that you're looking to make? Within an academic setting, you'll have a set salary. It's typically a guaranteed income, so you know what you're going to be making. The practice is already established, or the department rather is already established and built in already. Malpractice is offered to you, whereas in private practice, that's another cost added to your overhead. And then also, you're also not really as involved with day-to-day responsibilities from like state compliance, OSHA, HIPAA, and all the equipment leases. So those are things that you don't really necessarily need to bother yourself within academics. The cons of it, though, are you don't get as much autonomy that you might have in private practice. You're on, again, even though you're kind of guaranteed that salary, you're on a scale system. So you might be actually locked into that salary. And when you want to renegotiate, you might not have the legs to stand on because you're locked in, and it's not going to be able to also adjust to where the market's going if it's being raised in that area. You're also going to have a lot of pressure to publish from your department chair while you're staying in academia. You're also going to be asked to be with like different committees and have obligations to stay in touch with them. When doing your research, whether it's academic or private practice, you want to look at how they rank in the nation, whether they're have an academic rating or not, or a hospital ranking or not. A lot of this, I think Dr. Tobias and Jeffrey actually touched on this, was the PQRS ratings. That's really more so what's been drilled down on these doctors, whereas you've been training for the past 5, 7, 10 years on patient care. You're not really worried about nothing more than that. But that's something that the administrators are kind of drilling down on you. If you're looking at academic, is the facility been awarded in research? How renowned? What have they been studying? What are they known for? And is that the specialty that you're going for? Do they have a good pedigree of physicians there that have been renowned and noble in their industry? Those are the things that you definitely need to be looking at. And again, just look at who's working there and see if you can mimic their resumes and where they've trained and what they've done. And I'm sure they'd actually have open conversations as to their experiences working there as well. I think Dr. Tobias also touched on this, is really just being honest and knowing with yourself and knowing what you want. What were your best experiences during your training? And that's what you want to replicate in your job. If there was a specific time where you were doing just inpatient rounding and you were just in the OR, then you want to find the job that just is going to mimic that. If you're okay with the office work, if you're okay with the administrative work, you want to find the job that's going to be able to mimic that. That's how you're going to recreate that, and that's how you're going to be honest with yourself to know where exactly you're going to be ending up. It's important for you to make a list of this. There's tons of resources at your hands. You could talk to doctors that are training with you and see how they did it, and talk to your peers as well. You're going to go on tons and tons of interviews and meet people along the lines that are competing with you in the same jobs. You're going to be in the same car with them sometimes, even from the airport. Ask them where else they've been interviewing, what their experiences were. How did that chairperson interact with you, and kind of compare that with your own interview and see what your thoughts were about that. When interviewing with the actual practice or the department, make sure that your medical philosophy is in line with what yours is, what you've been doing, what you've been training on, what you've been educated on. Is that the same philosophy as this doctor? If this doctor is more worried about the business and you're worried about the patient care, then you already know you're at a clash. Is there consistency amongst the group members there? Are they all kind of the same personality? Or is everybody kind of different? It's a melting pot. If you have the same ideals in the patient care, then you know you're in a place that you're going to be successful and going to be happy and have a long career. If you have the same thoughts in economics, if he or she's only talking about the economics and the business and the practice, and that's all you're really worried about, then you're going to hit it off right away. At the end of the day, you just want to ask yourself, though, do you see yourself fitting in? Is this someone that you're going to have a meal or have a beer with after work one day? Because at the end of the day, as Dr. Tobias said, you're spending just as much time in this environment as well as with your family, so you need to have it as a close environment. Extremely important to definitely know the practice or the facility that you're walking into. You got to ask the tough questions. Google will be your best friend, obviously. Look at the website, read the reviews on the practice, go to ZocDoc, see what these patients are saying about the physician. Look up publications of the doctor. What have they published? When was the last time they published? What are other people saying about the program? It's all on the internet. It's at your availability. There's no reason why you shouldn't be doing that research. And when you're trying to get to know the practice, also try to get an idea of what's going on in that landscape going back to the region. I know, I'm not going to name names or even the region, but I know of one practice that a doctor signed up for, but he then found out that it's actually about to be sold to another hospital. he just signed up and committed. Now he's kind of at this crossroads. What am I going to do? Do I really want to join this? I thought I was joining a private practice. Now I'm about to join a hospital. So do your due diligence. You can ask the tough questions. Where is this practice headed? What are your financials? And they should give it to you. Again, knowing the practice, do they actually need your expertise? If you're a complex spine fellow and they have a cerebral vascular position, then it's not going to be something that's a synergy there. Is there enough volume for you to be supported? Are you going to be one of 3 or 4 neurologists in that practice doing the same exact thing? Then where is that referrals coming from? What patients are you getting? Are you third on that totem pole? And if so, how do you grow and move up on those ranks? And then you're also going to want to look at the patient volume as well as the surgical volume. With the surgical volume, you want to know also, are you competing for OR time? Are you competing with the local hospital's employees? Are you competing with the practices, other competing spine surgeons? Those are things you need to consider and where these people have privileges and are doing surgery. Again, knowing the practice, you want to know the other major players in the area. You want to know if they're taking your OR time also. How busy are they? How long has that practice been in the area versus the practice that you're interviewing with? What payer mix is that competing practice versus the practice that you're interviewing at? And this also all applies to academics as well in the hospital environment too. And you're also going to want to look at what patient population your competition is seeing versus what your current practice is seeing. You're also going to want to know, again, with the competition, what hospitals are actually in this region. What structure and do they have within that facility? And again, you're competing for the same operating room time. I know a private practitioner that's doing surgery at a New York Presbyterian, but he has to compete amongst the other physicians there. And I think there might be other private practices that are also competing for OR time there. So how do you get that carte blanche to go into there? How many office locations? Am I traveling from west of New Jersey all the way to the east side of New Jersey? Am I traveling from Great Neck, New York to Cold Spring Harbor? Make sure you know what you're getting yourself into. Will you be serving all of them? And what are the differences? Is it really just outpatient offices here? Am I going to the OR here? Am I taking trauma? Am I taking call? These are the tough questions that you need to ask. What is the practice or the hospital doing for me? How are they getting my name out there? Am I the one going out to these referral networks? Do I have a marketer? Are they putting my name into Becker's? Are they putting my name into periodicals? These are the things that you need to find out. Are they providing me a PA? Are they giving me a scribe? Are they giving me a billing manager, someone specifically to do my coding? That's half the time people's procedures are being denied by coding. And you're losing money that way. You don't see money, year out, 2 years out. What's my path to partnership? How long is that road? And that's the same thing also in academics. What's my path to chairperson? What's my path to co-director? Who's in front of me? How long has that person been in there? And again, you want to know what the other services are there. Is it an internal referral network like a Mount Kisco CareMount system? They might be referring within each other, so that's sort of built in. Can you buy into the ancillaries as well into the facility? Can I make money off of the other doctors there doing procedures because I have a piece of that ASC, or the PT that's in that facility? And what other ways can I make money from here besides seeing patients and doing surgery? Again, to the promotion. What are they doing for themselves? Is their faculty right now on LinkedIn? What is the department doing? Are they advertising? We just got this new robotic arm. We just got this new piece of equipment, state of the art, and this is why you should be coming here. If they're not advertising, if they're not promoting themselves, then why would you want to join them? That's the real question that you want to know. Social media is one of the biggest things right now that we have. So you want to know that they have a presence there. And again, everything is on the internet. You want to check what the ratings are, what people are saying about them, and how relevant that practice or that department is in their specialty. Now, I'm not a lawyer, not an accountant. So as Jeff and I think Tony mentioned, find a professional, but don't try negotiating these contracts on your own. It'll be a downward spiral. There's going to be fine print in these contracts. What's the restricted covenant? What's my non-compete? Can I leave Tony's practice and go and not get sued? Like, these are the questions you need to ask and know what you're walking into before, signing on that dotted line. So make sure you do retain and find the professional help that you can. If the practice is a reputable practice, they should be able to disclose their financial status. You want to know if they're in good standing when they are making you an offer. Are they able to support what they're offering you and give you the patient population? Are they about to sell out to a hospital? You want to know this before you're walking in. Is that salary structure a guarantee? Do I have a buyback clause? Do I owe money if I leave after a certain amount of time? The eat what you kill model, if I hit a certain amount of procedures and whatnot, you're going to make a certain amount of money on top of that. But then you got to ask the questions of, how am I getting those patients, and make sure you can hit those goals. Are these goals actually attainable? And then you're also going to look at other bonus and incentives. That goes, again, with the ancillaries, the ASCs, the PT, and other ways of making revenue. But again, these are all things that you should be bringing to your accountant and to your lawyer. Don't try to do them on your own. Again, when consulting the lawyer, or you can even ask this question directly to the practice to see what their upfront answers are, but how do you buy into the practice? What is that number? And what is the buyout if you were to decide to leave? What's the retirement policy? Do I have tail coverage if I leave or when I retire? What are the practice's assets that I can get into? And again, the non-compete. You want to make sure you're not restricting yourself. Do I have to move and uproot my entire family because I signed on this dotted line? That's something you need to be wary about when entering into a contract and negotiation with the practice or the department. Here we have a outline of from Doximity of pretty much averages of neurosurgeons throughout the entire country, and the subspecial and other specialties underneath from orthopedics. For the neurologists, I think you'd fall right in between preventive medicine, right around that range. But this is to help you in terms of what you're going to be looking at upon completing your residency and fellowships. Here's another image from MGMA, Becker's, I think, posted from MGMA, of the variations from percentiles of nationwide for neurosurgeons. Yes?
Yeah, from a recruiter's perspective, and I guess especially considering, let's say, younger physicians, when you're recruiting younger physicians, have you found text messaging by way of cell phone to be effective?
Extremely.
Yeah.
These surgeons are day in, day out covering call in the OR. It's my primary source of actually communicating with them. They're more receptive to the text and the email versus actually talking on the phone, because if I get them on the phone, I literally have 30 seconds to a minute of their time. Text message, they actually have time to think about an answer, talk to you, or at least give you an established time, like, all right, I could talk to you after 5 or 7 o'clock in the evening, and that way you can actually get them on the phone. Whereas your everyday worker is 9 to 5, so you in your industry, you may not be able to get that surgeon's attention, but when you need his downtime, you can make yourself available to actually have that appointment.
Is there a particular day of the week or time of day when you find people most receptive?
I probably steer on Fridays. I actually generally get to catch most residents and fellows. I think it's, generically a patient office day. Maybe that's truthful or not. You can answer that, but I tend to get more reception on that day versus any others, but I'm not going to say that there is an actual formula to that. Thank you so much.